Get ready for a financial jolt. Obamacare premiums are set to skyrocket for many Pennsylvanians. Monthly costs could soar by up to 300% for some residents using Pennie, the state's Affordable Care Act health insurance exchange. On average, enrollees might face an 82% hike. This means that approximately 450,000 out of the record 500,000 Pennie users are bracing for steeper premiums. Devon Trolley, Pennie's executive director, warns that the sticker shock could drive away about 150,000 people. There's going to be that sticker shock and some people will have walked, Trolley stated. However, this outcome hinges on whether Congress extends the enhanced premium tax credit, a Biden-era expansion of existing subsidies for Obamacare beyond the end of the year. But here's where it gets controversial. The fate of these subsidies is uncertain and the clock is ticking. Some see the upcoming federal funding bill due at the end of September as the last chance to preserve the more robust subsidy. We really see that as the last date to extend these in order to keep affordable coverage in place because open enrollment starts November 1st, Trolley emphasized. To prepare consumers, Pennie began sending letters last month to warn those who could lose part or all of their subsidy. Despite a June poll from the health policy non-profit KFF showing that 77% of the public supports extending the enhanced credit, Republican lawmakers remain divided. U.S. Representative Brian Fitzpatrick, R. Bucks County, has shown support for an extension, but others in his party are wary of the cost. According to the nonpartisan Congressional Budget Office, another decade of the program would cost $383 billion. This split could open the door for bipartisanship, especially since Democrats widely support the extension. Shana Jalbert, Director of Communications and Development for the Pennsylvania Health Access Network, is not overly optimistic. I don't think we're incredibly optimistic that Congress is going to renew this, Jalbert said. Trolley argues that the costs of letting the credit expire would outweigh any savings. When people can't afford health insurance, they often delay medical care, leading to more severe and costly treatments later. And this is the part most people miss. The enhanced premium tax credit, established in the 2021 American Rescue Plan Act, has significantly boosted Obamacare enrollment. It expanded subsidies for those earning between roughly $15,000 and $60,000 annually, capping premiums at 8.5% of income for higher earners. This generosity has led to record numbers of enrollees, both in Pennsylvania and nationally, with 24 million using the Affordable Care Act marketplace in 2024. The enhanced credit has also allowed more consumers to choose better health plans. Pennie has seen a shift from cheaper bronze plans to more comprehensive silver and gold plans. To qualify for subsidies, consumers must submit proof of income to their state's health insurance exchange. The exchanges are only available to those in the country lawfully, and whose other insurance options are unaffordable or inadequate. If the credit isn't extended, nearly all Pennie users would be affected. About 10% would lose the credit entirely, and 80% would see a reduction. Enrollees can estimate their 2026 monthly payments on the Pennie website. Many Obamacare recipients, such as low-income individuals and gig workers, have few other realistic options for insurance. Without the enhanced credit, experts predict that many of the 150,000 Pennsylvanians expected to drop Obamacare will be younger and healthier individuals. This could leave the remaining pool of beneficiaries older and sicker, driving up insurance rates. Insurers have already proposed an average premium increase of 19% for individual plans and 13% for small businesses. Highmark and UPMC, major insurers in Pennsylvania, support the enhanced credits, citing the benefits for their members. Highmark spokesman David Golubievsky noted that nearly 200,000 of the insurer's members have used the enhanced credit to lower their monthly costs. Extending these enhanced tax credits would help individuals and families find and maintain quality, affordable health insurance if they do not receive coverage through work or another government program, Golubievsky said. If Congress fails to act by mid-fall, Pennie will start sending personalized information to enrollees about potential premium increases. State legislators have also prepared for this scenario by granting Pennie the authority to establish an affordability program, though it currently lacks funding. The program is limited to about $45,000 in annual income, but without a funding source, it remains on paper only. State Rep Dan Frankel, D. Squirrel Hill, acknowledged the challenge. Our funding mechanism is designed to provide some support, but not backfill an entirely gutted program. It's hard to see how we could really step in and make it seamless for people. The state already faces cuts to Medicaid funding, and prioritizing funds to mitigate these impacts is a daunting task. Where do you put your finger in the dike to stop the flood? Frankel asked. What do you think? Should Congress extend the enhanced premium tax credit, or is it time to let it expire? Share your thoughts in the comments.